Hi everyone, in this video we'll discuss important classification of antibiotics for clinicians. So that is time dependent and concentration dependent antibiotics. This is got practical implications for our daily use. So traditionally antibiotics are classified based upon the mode of action like cell wall inhibitors and protein synthesis inhibitors like this. And other way of classification is bacteriostatic and bactericidal. The third most important useful classification for surgeons and physicians is concentration dependent and time dependent. So antibiotics, usually two types are there, and bactericidal that kills the bacteria, and bacteriostatic they arrest the growth and multiplication they arrest. But phagocytes they engulf the bacteria. Traditional classification is there, and we don't need a detailed PKPD. There is pharmacokinetics, pharmacodynamics of antibiotics, but you need some basic PKPD of drug for better use of drugs. Pharmacokinetics is what body does to the antibiotic. Like we all know, four steps are there: absorption, distribution, metabolism, and elimination. Pharmacodynamics is what antibiotic does to the pathogen. That's called pharmacodynamics. And important concept you should know is minimum inhibitory concentration. That is MIC. So there is a minimum concentration of antibiotic that can inhibit bacterial growth. This is oversimplification of the MIC definition, but this is enough for clinicians. So we have discussed there are two types of antibiotics. One is concentration dependent, other is time dependent. In case of concentration dependent, when we see this graph, the x-axis is the time since the infusion of the IV antibiotic. The other axis is concentration of antibiotic in plasma concentration. So this dotted horizontal line is called MIC. That is the minimum concentration of antibiotic that can kill the bacteria. This is MIC. In case of concentration dependent antibiotics, after giving the transfusion of the antibiotic, the concentration of the antibiotic in the plasma should reach above the MIC. That should be at least 10 times that of MIC. So you should have very high peak in the plasma so that it can kill maximum number of bacteria. So these concentration dependent antibiotics should have higher the dose. So higher the killing. The more the higher the dose and the higher the killing of antibiotic and bacteria there. In case of time dependent, need not be the concentration very high above the MIC. That should be just above the MIC. But here the duration important. If the transfusion is prolonged for more than 3 to 4 hours, then the killing will be maximum. So difference between concentration is concentration dependent antibiotics, the dose should be high to kill maximum number of bacteria. In case of time dependent, is the duration of transfusion that is very important. In concentration dependent antibiotics, the two most common we use is aminoglycosides, that is amikacin. The second one is fluoroquinolones, levofloxacin. These two antibiotics we use almost daily in the OPD or ICU somewhere. So these two are concentration dependent antibiotics, means they should be given in a single shot, but the dose should be very high. Means because of the high post antibiotic effect, the action of these bacteria will last longer. So when you take amikacin, the dose should be 1 gram OD, single dose. It is crime to give amikacin 250 mg PAD or 500 mg PD. It should be 1 gram single dose. And when it comes to levofloxacin, it should be 750 mg OD, not 250 mg PAD. Because of the concentration dependent, these antibiotics should be single shot high dose. This is the graph of the MIC. This is the concentration of the drug above the MIC. It is almost 10 times that of MIC, so that it can kill maximum number of bacteria. In case of time dependent, the concentration in the plasma should not be very high above the MIC. It should be just above the MIC. But here the catch is it should be prolonged infusion over a period of 3 to 4 hours to kill the maximum number of bacteria. What we commonly use time-dependent antibiotics are beta-lactamase like penicillin, carbapenems, piperacillin tazobactam, cephalosporins, ceftriaxone. So here the killing depends upon amount of time above the MIC. Here the concentration is just above the MIC, but what we need is prolonged action infusion above the MIC. So this is called post-antibiotic effect. It is the time period after the transfusion of the antibiotic for how long it will remain in the plasma and kill the bacteria. The concentration dependent antibiotics has higher class of post-antibiotic effect. Because of this, even though we give single dose, because the prolonged post-antibiotic effect will kill maximum number of bacteria. So protein synthesis inhibitors, most we have already talked about aminoglycosides, the amikacin, they have longer post-antibiotic effect. So single dose is sufficient for them. The cell wall synthesis inhibitors, we also know called penicillins or carbapenems, cephalosporins, they have shorter post-antibiotic effect, so they should be given at frequent intervals, but over a prolonged period of time. So already discussed, these are amikacin, levofloxacin, single shot, high dose. So take home message is, at least you remember this last slide, that's enough for us, for clinicians. So concentration dependent killing, single shot, high dose. Two most common examples, amikacin 1 gram OD, levofloxacin 750 mg OD. Because of the single dose, single shot, patients have better compliance. In case of dose dependent killing, the doses are multiple, but the infusion should be prolonged. One injection should be given over a period of 3 to 4 hours. Example like piperacillin, tazobactam, ceftriaxone, meropenem, most common used drugs, they should be given over a period of 3 to 4 hours. So this is the basic difference between concentration dependent, time dependent. Thank you very much.